So for patients with severe to profound hearing loss, whereby there is insufficient cells in the inner ear, hearing aids would not be enough to provide adequate benefit. For such patients, technology that is available is the cochlear implant. And how the cochlear implant works is that it is surgically implanted and it electrically stimulates the hearing nerve without the need to rely on the cells of the inner ear. And normally this technology is done such that it is surgically implanted in the ear, and essentially there is an inner component as well as an external component. The internal component is something like that. The cochlear implant has two components. So this is the internal component, which is surgically implanted into the ear. Essentially, the tip of this electrode array, this part, goes into the cochlea, the inner ear, and the body over here would be placed beneath the scalp. Although there are small risks such as injury to the nerve that supplies strength to the face or serious infections. However, these serious potential complications are minimized with proper care and with experience on the part of the surgeon. After the operation, the external component is applied, and which essentially looks like that. So this part is hung behind the ear, and then this part is placed over the internal device with the scalp in between, and the two are attached by means of a magnet. So sounds are received by the external component, processed and sent via radio waves such that it activates the internal device, which in turn activates the nerve. This technology, I've introduced it in children in Singapore almost 20 years ago, and the results, I have to say, are in most cases extremely encouraging. So children may be born deaf, and with the implant, many of them with proper rehabilitation have gone into normal schools and doing very well in normal schools. And for the adults, many of them who have lost their hearing have eventually regained their hearing and have gone back to their meaningful jobs. There are also other implants, hearing implants that are available besides the cochlear implant, and this include middle ear implants, which works by a device which is surgically implanted into the middle ear. So what it does is that it provides additional energy to move the hearing bones in the ear so that the sound becomes louder, and that might be sufficient to overcome patients with moderate hearing loss.